From the News Channel 5 Network, this is Medical Mondays.
Good evening, everyone. Thank you so much for joining us here for Medical Monday right here on News Channel 5 Plus. Tonight's topic, one that a lot of us can relate to, one of the most talked about cancers, that is breast cancer. And tonight we're talking about some good news, advances in treatment. And who better to join us this evening than Dr. Pat Whitworth. Thank you so much for being here tonight.
It's great to be here.
Well, we're happy to have you on. And, you know, we have some new things to talk about and new treatments, as well as a device that you actually brought with you here this evening. It's called BioZorb. I actually have a few there on the desk for us, and we're going to talk about all this tonight, as well as just different facts and things to know about breast cancer. I think it's definitely a cancer that pretty much everyone we know has been affected by, which is why we're glad you're here tonight.
Thank you. It's good to be here.
I'm kind of excited to talk about some of the treatments that we're seeing and some of the advancements that you know, doctors have been making. In fact, you actually brought something with you tonight that we're going to be talking about a lot this evening, and it's called BioZorb. Tell me why you wanted to bring this evening and kind of discuss this.
Well, you know, women are first concerned, am I going to live? And am I going to be able to do the things I did before? But then they're also a little concerned about their appearance, and rightly so. It's upsetting to have to remember you've been treated for breast cancer because you're not as happy with your appearance. So more and more these days we do lumpectomy instead of mastectomy. We still do both, but we are really learning that lumpectomy gives us the same cure rate, and it's a lot easier on folks. But if you do a lumpectomy and you don't do anything to kind of make up for it, that area of the breast can sink in, can collapse a little bit. So we do some plastic surgery techniques, oncoplastic surgery we call it. We do a little lift in a lot of cases. The women who have breast cancer often are in their 50s and 60s, and the breast tissue has moved down a little bit, so we can do a little lift. But this device is sort of a partial breast implant, but it's temporary. It dissolves over the course of about 1.5 years or 2 years, so that we can really put a little scaffolding in there, and as that breast tissue heals, it heals in that nice full format instead of collapsing.
Now, when you first saw this device, what was your initial reaction to it?
I was pretty excited about it. You know, we see a lot of new things, though, and so you have to be skeptical at first. The advantage here is this device was really developed and originally was meant for, and still is, for guiding the radiation. So this little spiral that you'll see, most of it dissolves, but there are little metallic markers in there that are very small, but the radiation doctor can see those on an x-ray and can guide the radiation so that we don't have so much radiation to areas you don't need. They can really focus on that area where you do need it.
It almost serves a double purpose in a way. So it's a filler as well as an indicator.
Yes.
Incredible.
Exactly.
And we actually, they're laying right there on our desk. Let's go ahead and we'll kind of show these to folks.
Should I pick them up?
Yeah, I think we should. I mean, we might as well. We brought them here, and I mean, these are really incredible, and I'll leave you with this one. And now what you can see here, again, we're talking about a device called BioZorb tonight with us, Dr. Pat Whitworth of the Nashville Breast Center, just talking about the advancements in breast cancer treatment. Of course, this is an interesting device, and I'm going to hold it down a little bit lower here so folks can see it. You know, it's just amazing some of the advancements that we're making, you know, in treatment. And as a doctor, again, I asked you, you know, your initial reaction, so let me ask you, how long has this been around now?
It's been around close to 3 or 4 years. I've only been using it for a couple of years. We are all, as I said, some of us adopt things very quickly, and we tend to do that. But this was really impressive as a way of not only guiding the radiation to targeting the radiation better, but you know, it was clear from almost the very beginning that you could really support the breast tissue while it was healing so that it wouldn't flatten out, so that it wouldn't collapse.
Okay, and so, you know, how many surgeries would you say you have actually performed using this device?
I would say somewhere in the neighborhood of 30, something like that.
And, you know, what's kind of the feedback that you get? Is it something that, I mean, most folks, they never really had this surgery before, so it's hard to tell one way or the other, but what would you say the overall outcome has been for you?
Well, initially, especially, women are happy to see that their breast looks the same, or the shape looks the same. It doesn't look like they've lost anything. And then they can feel it a little bit, though, so you have to be reassuring about that. But it softens up after about a month, and again, after about 1.5 years or 2 years, it has dissolved, and the tissue by that time has had a time to sort of form in that shape.
You know, I mean, again, if you're just tuning in, we're talking with Dr. Pat Whitworth tonight just about different advancements in breast cancer treatment. And one of the most common uses for this is when a lump is removed from a breast. I mean, you're dealing with, it could be a rather large area, that this is a perfect device to basically serve as, I mean, it's a spring device as well.
That's the largest one. This is probably something we use more often, right, in this size. But it really depends on the amount of tissue that we've had to remove so that we fit that space, and we don't want to expand it, but we don't want to collapse it either.
Obviously, a larger tumor, you're going to use this one, smaller tumor for that one. That was one of my first questions when you actually showed up tonight and brought this device in, was, you know, what is kind of the difference, why the two different sizes? And one thing to note too that you had mentioned earlier, this actually, it dissolves over time, so there's no needed surgery to remove it. Is that correct?
That's right.
What an advantage as well. So some other just kind of reactions to this, to you and your friends in the medical field, just some obviously it's a device that I'm sure you all are excited about, and any other kind of feedback that you've been receiving from this?
I think all of us have been pleasantly surprised. We were initially, you know, fairly easily convinced that it was going to target the radiation better. But was it really going to help with the cosmetic outcome? Was it really going to support the tissue in the way we thought? Were women going to be happy with it? And all of those things seem to be moving in the direction really surprising us with how well things have gone.
That's what it's all about. Wonderful. Well, we'll stay right here on The Plus. We'll be right back to talk more about these amazing advancements in treatment. We'll be right back on your Medical Monday.